Welcome back to our YouTube channel where we share the latest and greatest fertility research that very few people are talking about. My intention with each video is to help share information and to equip parents-to-be with the educational information simplified from complex fertility concepts to easy to understand approachable concepts to help empower you to close this chapter on your fertility journey. I would love to keep sharing these videos with you, and if you'd like to keep receiving them, hit that subscribe button below this video. Imagine there was something that you could be doing to help improve your pregnancy, your overall reproductive health, and specifically for assisted reproductive technologies like IVF, may potentially actually improve your chances of conceiving as well. This is exactly the case when we look at diet and lifestyle to help prepare for fertility treatments, whether you're trying naturally or using something like IVF or IUI. Now, what can be actually quite interesting is that patients are often told that there's little to no impact on diet and reproductive health and fertility. So a lot of patients have this belief that whatever they're eating, whatever their lifestyle is like, whatever their nutrition is, it actually has very little impact on outcomes with things like IVF or IUI. And like we're going to see today by the end of today's video, that's not really the case. And in fact, this becomes a missed opportunity for a lot of people that are trying to conceive. And I cannot exaggerate the importance of lifestyle and diet on its impact on reproductive health and pregnancy rates, embryo quality, and so forth. So, and especially if we look at really multiple fields of medicine, like if you talk to a cardiologist and say, hey doctor, does diet impact my heart health? The answer is a very resounding yes, it does. If we speak to an oncologist and say, can diet and lifestyle impact the lifetime risk of certain types of cancer? Yes, it can. If we speak to a pain management or a pain intervention doctor, can my lifestyle, diet impact my chronic pain? Yes, it can. So, really diet and nutrition is a foundation of your well-being. So it really makes no sense when we say, lifestyle and your diet don't impact fertility. And it's really just putting patients at a disadvantage because there's something that we could be leveraging to actually improve and support our chances of conception right from the get-go. And I love this because it's something that everyone can implement. You don't really have to go out, and we're not spending thousands of dollars on some specific type of treatment or medication. Diet and lifestyle, we're going to eat anyways. It's really just going through the filter of what's a pro-fertility diet from an evidence-based perspective, and how's that going to help me conceive, and potentially even help you conceive with things like IVF, as we're going to see, because we're going to talk about a research paper published in the Frontiers of Nutrition in July of 2022, so just less than a month ago, and they included 170 research papers in this review, all looking at the impact of diet, lifestyle, micronutrients, and certain macronutrients, and how they can actually impact things like IVF outcomes, pregnancy rates, embryo quality, etc. And the findings really suggest that this is something that we need to be considering for patients that are trying to conceive, and especially if they're struggling to conceive. So let's dive right in. What were the outcomes from this study? Well, they broke it down by macronutrients, lifestyle, or types of diets that go with lifestyle, and we'll jump into what that includes, and then specific micronutrients. And just so we are clear right from the beginning, we're not going to chat about specific supplements or micronutrients because there is a lot of research on specific nutrients for specific conditions like endometriosis, fibroids, polycystic ovarian syndrome, and so forth. But this is overall just generalized diet and lifestyle advice that we've seen coming out of the research now. So the first one they looked at was the role of proteins. And I know there's so many different types of diets out there that promote different types of meat, animal protein, plant-based protein. So, we're not throwing shade on any other type of diet or for specific conditions, but specifically for fertility, we've seen a consistent picture painted over the years with the research, which is suggesting that things like red meat actually tend to be worse for fertility. And it might be related to some of the environmental contaminants like dioxins. We see the role of certain antibiotics. Beef cattle in Canada, we can still use 3 types of synthetic hormones or 3 types of natural hormones in the actual meat itself. So red meats in general, we see this for sperm factor, uterine factor, ovarian factor, may really not be the best thing. And we're seeing in observational studies and trials that's actually associated with lower live birth rates as well. And then looking specifically at omega-3s or omega-3 food sources like seafood, we see the opposite. So we see patients as they increase the amount of seafood that they're having, so high sources of omega-3s, they see benefits like increased levels of progesterone, thicker uterine lining for fertility treatments like IVF, potentially better embryo quality. And there is a bit of a caveat to this, so they do find you have to be very careful about the type of fish you're consuming as well, because certain fish are more likely to have high levels of mercury. So for example, in some of these observational studies, they actually recommended staying away from things like swordfish or king mackerel, which may have actually higher levels of mercury compared to others. And then the plant-based proteins is an equally important component. So we see that actually increasing the amount of plant-based protein you're having seems to have a very beneficial effect on ovulatory function, and the normal functioning of the ovary. It may help to support positive outcomes with fertility treatments, and it may be related to the fact that plant-based protein sources usually have more fiber. They tend to have a lower glycemic index, so they don't shoot the blood sugar as high as certain animal-based proteins. And particularly for polycystic ovarian syndrome, they've seen including more plant-based proteins can actually help support regular spontaneous ovulation and having more regular cycles. The second macronutrient that they looked at in this big review was the role of carbohydrates. And I know this is super important, and we always have a bit of a chuckle when we're doing consultations because, as you probably guessed, things like sugars, processed carbs, all the most delicious items that we usually have in our day-to-day item, these processed carbs are like confectionery items like cupcakes, cookies, muffins, and just sugars in general. They unfortunately do decrease in these observational studies. They've seen a decreased decreased likelihood of things like pregnancy and delayed time. There's a delayed time to actually getting pregnant as well for couples that are trying to conceive naturally. With things like IVF, the outcomes of IVF really rely on multiple factors, but one important factor is what we call the ovarian sensitivity index, or OSI. So it's how does the ovary actually respond to things like the fertility medications. And what we see is that having high glycemic load or very high carb and heavy carb foods in your diet can actually reduce the number of follicles retrieved and affect the maturation of those follicles potentially as well. So we see having low glycemic load, lower carb diets is actually associated with more eggs retrieved and potentially better outcomes for things like IVF. There is some research suggesting for sperm factor as well that having a slightly lower carb diet may actually translate to improved sperm health as well. And that seems to be related potentially to the fact that lower carb diets tend to reduce the amount of oxidative stress in the body, may help to deal with things like insulin resistance or high insulin levels, which in itself can drive harmful changes like increased oxidative stress in specific tissues like the reproductive organs. And for fats as well, a very important detail to mention was the role of trans fats. And I know we talk about this a lot for heart health, but really no one's mentioning this for fertility. But trans fats have been shown to actually affect, again, ovarian function, may affect the production or the potential positive outcomes that we're looking for. They see increased levels of inflammation and they see increased levels of oxidative stress dealing with coming from the trans fats, particularly related to ovarian function in these studies as well. So reducing trans fats is generally recommended for patients that are struggling to conceive or considering trying to conceive. And then we looked at different types of diets, and mainly they looked at Mediterranean diets versus the standard American diet, which is usually high in sugars, high in fats, low in fiber. And using something like a Mediterranean diet, which includes a lot more fiber, healthy fats, not as many sugars and carbs, using multi-grain, whole grain, high quality carbs, lots of veggies, and more lean meats and seafood versus things like red meat. We see that the Mediterranean diet again is associated with increased positive outcomes for things like IVF, and things like increased fiber may actually be associated with improve fertility as well. And fiber in general is a very undervalued nutrient. It is a super nutrient, including more fiber in our diet. And most North Americans are deficient. They're not meeting the daily recommendation of fiber that they should be having. Has a huge impact on the gut microbiome, insulin resistance, insulin sensitivity, and potentially inflammation as well. And so conversely, the standard American diet was shown to reduce the chances of positive outcomes with fertility treatments, as we would expect. And then particular nutrients, micronutrients in general. So we see things like vitamin D, for example, have now been extensively studied in observational trials, where we see that if vitamin D is low, implantation rate might be lower with fertility treatments. We might see increased miscarriage risk. We may see a lower pregnancy rate with things like IVF as well. Now, these are all observational studies, but again, the data does paint a very consistent picture across the years when we see more and more trials coming out on this. And then increasing vitamin D levels may be associated with better outcomes as well. And particularly when we look at minerals, there's two important minerals to mention, zinc and selenium. Now, very few people are aware of this, but when you go through an assisted reproductive technology, what we've observed in some of these trials is that patients actually become temporarily deficient in zinc after finishing a treatment cycle. And that's potentially, it's hypothesized that zinc is utilized with the physiological changes that are induced with the medication, and that the month after, to resume or to replenish those zinc levels, they actually may need to focus more on zinc-heavy sources and dietary supplementation of zinc the month following an IVF or assisted reproductive technology, to help replenish those levels again. And why is zinc so important? Well, zinc and selenium both, we've seen that if they're deficient in a patient, then there's usually a longer time to pregnancy in these observational studies. And so if we have optimal levels of zinc and selenium, then we tend to see better outcomes, quicker outcomes. And we have to be careful, because if we start to get into toxic levels, so if you're taking very high doses of zinc and selenium, it can again delay time to pregnancy and have an anti-fertility effect. So there's kind of that sweet spot of what we consider healthy levels for selenium and zinc. Sometimes a blood test can help just to see where the zinc levels are. But especially if you're doing back-to-back fertility treatments, it is important to look at, zinc impacting your potential future outcomes as well. Speaking with a nutritionist, your healthcare provider, your fertility doctor, zinc has a very important role in supporting normal ovarian function as well. And zinc deficiency can actually affect things like follicle production and maturation potentially as well. And then another nutrient was copper. So we see if copper levels are normal or ideal, that can actually support a good microenvironment in the ovary and the follicular fluid that supports, again, healthy fertility and potentially positive outcomes. So these are important minerals to keep in mind if you're trying to conceive, and potentially if you're doing back-to-back treatments, to actually consider testing some of those mineral levels as well, or making sure you're getting a good amount of those minerals from your diet as well. And I also would like to mention that, how do these dietary changes even impact our reproductive outcomes and fertility and overall reproductive health? So because these are a lot of observational studies and trials that we're seeing, we have good hypotheses, but we're still learning on what that actual mechanism of action is. So the three main things that the researchers have hypothesized how diet can actually impact reproductive health seems to be related to the function of antioxidants. So diets like the Mediterranean diet, which are very high in polyphenolic compounds and antioxidant substances, may actually help to reduce things like oxidative stress in the body. We see that certain dietary patterns, particularly ones with higher fiber, can actually impact the microbiome, which we know has a huge impact on insulin resistance, inflammation, hormonal levels imbalance. And thirdly, we see that the diet can actually induce epigenetic changes as well within certain patient groups. So there's a growing body of research which is looking more specifically at more personalized recommendations and nutritional and dietary recommendations based on genetic background as well. So these are very important things to cover, and really, if you're ignoring the role of diet and fertility on potential impacts on your outcomes there when you're trying to conceive naturally or with assisted reproductive technologies, it's really just a missed opportunity and an easy variable and factor to modify and to leverage to benefit our chances to hopefully have a successful outcome with any treatment that we're pursuing for fertility.